Hello, everybody. We'll get started as soon as Collins gives me the A-OK to start. Thank you.
You're welcome.
Just think I won't be a pain in your butt after today.
Yeah, I think we're live now on Facebook.
Okay, so you ready?
Yeah, Ken Cornell, I think we need to give him just a minute. He's logging on. If you want
I can
to.
go ahead and it'll take a minute to get through the preliminary stuff that I got to go through. So
Okay.
go ahead and call this meeting to order of the October 19th, 2020 a meeting. And I believe, correct me if I'm wrong, Colin, this will be the last one, unless we hear otherwise, that will be Zooming and we'll be live after this one. So I have to go through my spiel. So if you are listening or watching the meeting through the webinar format, please use your raise your hand function. Simply click on the participants icon in the Zoom toolbar and look for the raise your hand button on the bottom of the right-hand side of the screen. Those of you viewing the meeting through the webinar may also comment via the chat function. If you are watching through Facebook and would like to comment, please call the call-in number at 1-346-248-7799. That's 1-346-248-7799, and use the meeting ID 813-2467-3510. That's 813-2467-3510, and I believe it's on the screen as well. So the first item will be the roll call. And I'm going to do it a little bit different. So Suzanne, you're usually second to last. I'm going to go ahead and put you first.
Okay, present. Thank you, Mr. Chair.
Sure thing. Member Twombly?
Here.
Member Snyder?
Here.
Member Lombarda?
Here.
Member Hart?
Here.
Member Cornell? Member Cole Smith?
Here.
Member Clark? Member Certain?
Here.
And I'm here. Okay. With that, the first item will be the approval of the agenda. Were there any revisions that anybody saw in the regular agenda or the consent agenda? If not, if there would be a motion, that'd be great.
So moved. This is Tina to accept the agenda as presented.
Second, Megan.
Okay, we have a motion by member Certain and seconded by member Labarda. Is there any discussion? Any public discussion? There being none, all those in favor of the motion say aye.
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 Those
Aye.
opposed? The motion is unanimous for those in attendance.
Hey, Chair Pinkerton,
Yes.
member Cornell is on the call now. I didn't hear him say yes, present when you called his name, but he's on the
No.
call.
Okay, can you hear now?
I'm here, Lee.
Okay, all right. Thank you, Tina.
You're welcome.
The next thing would be the executive director report.
Good afternoon, everybody. How are you? I didn't have a written report, but I do have 4 or 5 items I just wanted to bring to your attention and discuss if necessary. Number 1 is at the last meeting, you voted to ask me to work with UF, the College of Health and Human Performances, specifically the YDRPP, and negotiate an agreement originally to do a needs assessment around summer. That scope expanded to mental health and children in the juvenile justice system, I believe. And in talking with the researchers, as I had suspected, they're very willing to do the work, but if they did all of that work at that time, it would put us out of the time frame to actually meet the deadline to do anything meaningful for the summer. So what I asked them to do is put together specifically some programming around traditional, what we'd call summer learning opportunities. And then in maybe a second round, revisit some of the juvenile justice issues and mental health issues. And frankly, I probably, after I had a chance to re-listen to the meeting, I'm not sure I was exactly sure what you were looking for specifically. I think those are issues that we need to address. I'm just not sure how it tied in with what we wanted to do for the summer. But either way, if they had taken on all that, they wouldn't have been able to get this done to March or April, which is too late to get anything out for the summer. So I asked them to scale back to the original scope, which we're working on. And then I told them I'd come back to the board and get some clarification on kind of the 2 add-ons and how to proceed with those. I think my initial thought is we should wrap that in as part of our funding plan that that I reveal, I guess, in December, and that we start putting together in the first of the year. But I just wanted to bring that to your attention, and maybe we can talk about that once I finish making a few remarks here. The other thing I want to update you on is I had 3 positions open. 2 of those have been, offers have been extended and the candidates have accepted, and one will be starting, the communications position will be starting next week, and the director of programs will be starting, I think it's November 23rd. I'll be happy to tell you who their names are once they're officially here and in the seats, because you never know what will happen, but they're both very capable people. And I think you really enjoy working with them and getting to know them. Going back for a minute to the funding plan, because I've had at least a few conversations with some of you one-on-one. And I have been asked also to repeat this every meeting, because I know that in between meetings, you have a lot of other business that all of you concentrate on. But the motion at the last meeting was for me to take the rest of the year to finish staffing up with the positions that I'd advertised, and then come back or give me till the end of the year to put together a plan on how we're going to finish out our funding recommendations. And then come January, we'd begin to put those together. As it stands right now, our last meeting for this year, I think, would be December 7th. So my target date to have that plan together would be December 7th, which means that I'll spend most of the month talking to you, all of you, one-on-one, just to vet some ideas and to get a feel for how you would best be able to share the various expertise that you have. I'm leaning towards probably anywhere from 1 to 4 mini committees around our goals. I haven't really settled in on that. I'd like to vet some ideas by each of you. And as part of that work, there would be some input from what we'd call subject matter experts to fill us in on how they see the various systems that we interact with here in Alachua County, and how we might be able to best use our funds to really do some things that none of those systems are able to do, and really make the kind of changes we want to see. That's where I'm leaning. I'm not sure if it's 1 committee, 2 committees, 3 committees, 4 committees. I'm not sure how often they'll meet, because a lot of that depends on some of the conversations we have behind the scenes. I'm thinking that these committees would be more task force, meaning that they have a beginning and an end, and that once we get our plans in place, that we would move to, maybe another structure where we have that ongoing, an ongoing program committee that is responsible for overseeing the periodic evaluations of all of the programs that we end up funding. So that's where my thinking is at this point. The other thing I wanted to just let you know is that in talking with my colleagues and some of the other children's services councils around the state, the idea of assessing needs and filling in gaps in the community to change systems is really an ongoing process. So it's not something that's done just once and there you go. It's something that's done continually. In other words, that process in itself is systematized throughout the community, which is also something that we'll need to. I don't see. So my initial take is that that's really a gap. If there's something that's siloed, it's that ongoing process between policymakers and funders to collaboratively address issues in our community. I'm not sure. There have been other attempts in the past through children's alliances and other collaborations, and I'm not sure if that's something we'll solve overnight. But as I'm thinking forward, one of the things that I'm going to be looking to contribute to in the community is how can we systematically be looking at needs and gaps in data and filling those, as opposed to just thinking it's a one-time study that's done and completed, and then you wait until the next study comes out to act. So I hope that if these are the type of conversations I'd like to vet by all of you one-on-one. If you think I'm on the wrong track or something, feel free to speak up, but that's where my thinking is at this point. I'd also like to discuss for a minute the agenda for the 4th with the Gainesville City Commission. I spoke with the chair. I have never participated in joint meetings with other bodies like this. This will be a new experience for me. One of the reasons it'll be new is because where I came from, we had a consolidated government, so there was only one body. Right now, I guess my plan for our contribution, unless any of you have a specific thing you'd like us to bring up with the city, would be that on our end, our contribution to the conversation would be to update the city commission on our 4 priority areas and the data that we've gathered and the indicators that we'll be looking at, and maybe talk a little bit about the process and how we arrived at those. Spend just a brief period of time talking about some of the things we're already doing, including the programs we've already invested in, and some of the upcoming work we'll have with the Pritzker Foundation and some of the work we're doing up towards the summer. And then hear what what their priorities are, and then let you all discuss. I plan on meeting with or talking with the city manager between now and then before we publish an agenda. But that's really, that was really, my suggestion on how to approach that meeting. But I did want to give you all a chance, and I'll just pause right now, I guess. Is there anything else we should bring up in that meeting, or anything else you would like to discuss or think I should include in what we present to the city?
Anybody want to chime in? Okay,
This is Tina.
Tina.
I'm trying to raise my hand, but I'm not able to get over there.
Okay, Tina.
You
And then,
recognize me, Lee? Okay.
yeah,
Thank you. This is Tina. I was thinking that what is probably one thing we will discuss within the joint city meeting is how we'll collaborate probably on out of school and after school time. I kind of got wind of some info that was shared in a recent city commission meeting about, that was real similar to the groups, was it YPD? Positive Youth Development Group that they presented at a early meeting when the trust first started, you know? So, and I think the city is kind of looking in that same direction. So Colin, I'm not sure if you saw that same meeting, but I'm thinking it's probably going to, one of the items that they would want to discuss with us will likely be something around out of school time. And how we can collaborate or how the trust can fund that for the city is what I'm thinking it probably would be. That's what I'm expecting, so. That's
thank
my
you, Tina.
Okay.
Nancy?
I have a question. I don't think we've ever met with City Commission before, have we?
No.
So, so we ought to take a few minutes, Colin can do this, to actually tell the City Commission what we are about, because they have a huge agenda too, and they're busy in their business, and they, I'm sure, know that the Children's Trust passed, but they may not have any idea what we did before we were the Children's Trust on behalf of the county, and they have no idea what we did since. So we need to, get everybody on the same page, and then launch into what our agenda really is. And I really endorse what Tina said about the school-age children activities for them, especially where it concerns things that city really cares about. Like, doesn't city really care about what goes on in parks and recreation? And doesn't city really care about what goes on in transportation? Yeah, I mean, I'm trying to think of things that they're really familiar with. They're always their agenda items that we need from them. We ought to frame what we have to say to them to fit with what they're used to hearing and what they're good at. And I think they'll be happier to help us if we appeal to them in their areas of expertise and comfort. Sort of a general comment. I don't have too many specifics on that, but every time I've been to city, it's been about Parks and Rec, it's been about transportation and stuff like that.
Thank you, Nancy. Suzanne?
Yeah, I'm echoing what's already been said. I was going to recommend that we do provide an overview of our purpose, our objectives, and also, make sure that we understand how they're prioritizing funding in the same areas. And so we're not ultimately duplicating efforts, but I do think it's important for them to understand our role, our objectives. And I think that would be presented very well by you, Colin, or the chair.
Okay. All right. Any further comments? So Colin, is that enough information for you?
Yeah, I think what I heard is from Member Certain, to make sure we include in our discussion our interest in collaborating with them around whatever they're doing in out of school time in summer and figuring out how that would look. I think from Dr. Hart, she would like us to make sure we present the history of the trust, kind of from pre-trust to current. And then I think Judge Bullard essentially echoed both of those. And so I think that's great feedback.
And historically, Colin, when the county commission met with them, usually the county would submit a couple items and the city would submit a couple items. And I think that, our items would be what everybody talked about. But if there's something specific that they want to talk, if there are a couple items that they want to talk about specifically, we might want to get that on the radar. So it's at least on the agenda. So we might get some backup on what they're going to discuss before we get into the meeting.
Okay, I think that's great. I can do that.
All right.
I have one more thing before we leave.
And you actually had, do you want to have the mental health, discussion now? Or do you want to finish what you were saying? Because you brought
Yeah,
up.
we can,
did
that's fine. The only other thing I wanted to discuss, and we can do it after mental health and juvenile justice, is our meeting schedule going forward and how we're going to meet. So yeah, that's fine.
Go ahead and do that, and then we can get into the other thing.
Well, I'm not actually sure how we're going to meet. So I don't really have anything to meet. We're supposed to have a meeting on the 2nd. I don't have anything to meet about. So except for the month of November, the meeting on the 4th with the city commission. I think my time would be best spent preparing to present to you on the 7th what we'll do moving forward. So my recommendation is to cancel the meeting on the 2nd. And we can take that up in the action item section, and as well the meeting on the 16th, frankly, because as of right now, I have no agenda items. As far as physically how we will meet going forward, I think I'm going to need Bob to help me out a bit, because I think there's a difference between how the city's going to handle their meeting and how they're interpreting the law for that meeting, and then how we should handle our meetings going forward. But in the past, I think everyone's always read the law that you had to have a quorum present, and if you weren't physically present, you couldn't vote. I think that's changed, and so Bob, if you could, at least for your recommendation for our meetings, would you mind updating the trust on how you would recommend we proceed with our meetings, or what our options are?
Be happy to. This is an odd bit of the law. There is a long line of, it has traditionally been viewed among government attorneys that in order to have a quorum or to have a meeting, you had to have a physical quorum present, as opposed to anyone appearing by phone or video conference to allow a quorum. This is based upon a long line of attorney general opinions, which were based initially on school board opinions, but have been applied to other areas. Recently, when this COVID hit and the question came up, the governor asked the attorney general if that was still her opinion based upon, all government entities, and she basically said it was. So the governor has, since May or June, allowed collegial bodies to meet remotely, just like we have up to this point through Zoom or other means, as long as there's a reasonable opportunity for the public to participate. Now, the city is going to decide, basically from what I understand, is going to make a finding that being present means you are available by video conference. Because apparently there are a lot of people over there that don't want to meet. The county commission is going to do what we refer to as a hybrid, which is we are going to have a physical quorum meeting. They will be spread out in the Jack Durant's auditorium, and staff will be in there spread out, and the public will be appearing from remotely from either calling in or appearing in the Grace Knight auditorium. So we don't anticipate right now that anyone from the public will be coming into Jack Durant's to appear before the board, and then 2 board members will appear remotely, either from their offices behind Grace Knight or from their homes or someplace else. There is a segment of local government attorneys that believe that the Attorney General has it wrong, that as long as you are providing the opportunity for the public to participate in a meaningful way, that you can have a public meeting virtually like we have been doing. Now, the problem with doing that is that any business you take during those meetings could be held to be void because they weren't done during a public meeting. There's nothing in the sunshine meeting schedule ordinance, the statute or your statute that says the quorum has to be physically present. I've been unable to find any case law that says that. So a safe way to proceed is to do it like the Board of County Commissioners is doing it, like a lot of governments are doing it, with a physical quorum being present and then other people phoning in, and then having the public participate remotely or in a limited fashion in a meeting room if you can get a big enough meeting room. The alternatively, you can do it like the city and say, make a finding that we're going to do it fully remotely, and that's fine with us. One related issue, because this question has come up, whether or not individual members can appear remotely and fully participate in the meetings, regardless of what you do. So you have a quorum there, quorum physically present, and two people are not available, maybe for health reasons, maybe because they're out of state. Could they phone in and participate? You would have to adopt a policy that says, yes, they can, and this is how they do it, and this is what the board, how a board makes a finding at the beginning of the meeting that they should be allowed to participate remotely. Again, that's pretty much how the Board of County Commissioners does it, and there is no blessing on that from the state, but since you have a full quorum present, it usually doesn't cause any problems. So those are really your options, and it's a matter of how comfortable you feel meeting as a group, whether or not you want to try a remote meeting structure and make the findings necessary to do that, or go the middle ground that bodies like the county are doing and do a hybrid structure where at least 6 of you would be physically present in a room, and the rest of it would be done by way of Zoom.
Thank you, Bob. So I guess it brings to mind immediately, how are we going to have the meeting with the city if they're going to be remote?
I have not asked their counsel about that, but last the county attorney and I spoke to them. They were working on their virtual meeting, and where they were going to do it totally virtually. Since that is not if you are not going to be taking any formal business during that meeting, just discussion, you can probably get away with just a virtual meeting that is open to the public, because you aren't taking any business then. Any formal business will be handled at a later point when you have a quorum present or you've established a policy.
So during that meeting, we shouldn't approve the minutes or anything along those lines, or the agenda?
Right. It would basically be a workshop of sorts.
Okay, all right. And so that one, if Colin and everybody agrees, that one's kind of taken care of. But if we are going to do the other type, say the hybrid, then we need to have somebody draw up something where we make the declarations about remote participation. And I assume the county's already done that?
Yes, the county has a policy in place for that.
Okay,
And Lee,
all right.
Lee, I talked to Mark about this and he said that, I mean, he wasn't going to volunteer the county, but he said the county would be happy to help.
Okay.
With regards to if we wanted to use their room, as long as it was available. And he said, you know, their staff could help since they're going to be doing it for the county anyways.
So does that mean we have the county commission chambers? Is that what you're saying?
I mean, that's what I understood, is presuming we could socially distance and make that work. He just said, have Colin call him.
Okay.
I mean, do you want me to
Okay.
make a motion to that effect?
Yes, that'd be good.
Yeah, so I would move that we adopt a hybrid approach so that those individuals that cannot attend in person for whatever reason they are, can attend virtually. And that we request the executive director to coordinate with the county's IT and communications group on how that could happen at our, I guess, our next by our next meeting in November, which looks like will be either the late meeting in November or even the first meeting in December. That might give us a little bit more time.
Okay. We have a motion. Do we have a second?
Second.
Second.
Okay, we have a motion by Commissioner Cornell, by Member Cornell, and seconded by Judge Bullard. And any discussion?
Lee, I'd like to say, so I'm a young fellow, I'm 51, but I live with my mom who's 80. And so I would encourage that those that do not feel comfortable attending in person until we are literally past this thing to feel totally comfortable attending virtually. And I wanted to say that because I've got a similar situation over on the Board of County Commissioners, you know, Lee, with our members there. And I just want everybody to know that I'm happy to be that one in person and I can work out my home situation, but I don't want anyone else to feel like they have to be there if they have their own personal situation that precludes them and they don't feel comfortable with that. And I just want to make sure everybody hears that from me, that I respect that and appreciate that.
Okay. Dr. Hart?
Okay, it's time for me to be the doctor in the house. I think it's insane for us to meet in person in a public place unless we absolutely have to. And I think as the Children's Trust, we ought to figure out a way to make our own rules about virtual participation in terms of whether we ought to be allowed to vote on approving the agenda or the minutes or other things. I didn't hear Bob say that it was impossible that we could make our own rules about it, but we should make our own rules about it up front and not do them ad hoc when we find ourselves in a conflict with someone about whether we've followed our own rules. So I suggest that we create our own set of rules about virtual participation, how we can do it. And I really thank Ken for saying that even if we are not personally at risk, there are people in our lives who are, and we have to be really careful and we have to wear masks. And so what if you and I are in the same room and we're all wearing a mask? That doesn't resolve the air and the people who were in that space before breathing and who we encounter on the way there because we had to park our car someplace or we had to pay a parking attendant, or, I mean, I'm just making this sound crazy risky. And of course, we take risks every day when we decide whether we're going to the grocery store. But I do appreciate that we live in a county where people are evidence-based, and the evidence is that this thing isn't over. It's getting worse right now. It's going to continue to get worse as the weather gets colder. And I don't think it's time to relax any of our safety things that Colin has worked so hard to make sure that community can participate. And I think if we make sort of a two-class system where community can be in the next room, or maybe they can call in on the phone, it gets a little bit a little bit complicated, and I don't want to create a two-class system either for us or for community participation. Therefore, what I'm suggesting is that we decide what our rules are going to be ahead of time.
Okay. Anyone else? Tina?
Thank you, Chair Pinkerton. I'm actually in favor of, if we can continue the virtual meetings. I think it's actually expanded participation by a lot of folks in need. So kind of like Ken, I don't feel like I'm in jeopardy health-wise, but my grandfather will be 97 in a few weeks, and I'm checking on him once a week. So I do try to limit my contact with other folks outside. So I would if there's some way we can continue to be virtual, I'd appreciate that as well.
I'll chime in on, this is Maggie, I'll chime in on that too. I just think it makes more sense, given the situation, to continue to have the virtual option. In this day and age, when all of that case law was written, there were not the options for virtual meetings that there are now.
Anyone else?
Lee,
Yes, Ken.
I agree.
Ken?
Lee, so the county has created this hybrid approach because we're not sure under the law if we can continue to meet virtually. Bob, are you saying that the city is taking a different approach and that the special districts have that option to just continue hybrid?
Mr. Chair,
To continue virtual? I'm sorry, because I prefer that.
Mr. Chair, what we have been told by the city attorney is that her commission wants to continue to meet virtually, and therefore they're going to make a legislative finding that being present means being present virtually. The county attorney,
Are we able to make that same legislative finding?
if you follow, Mr. Chair, if you follow the logic that the city commission is doing, yes. It is clear from the governor's order and all the signals he is sending that it is his intent that boards and commissions meet in person come November 1. But again, there is nothing in the ordinance, the orders that the statutes that govern independent districts or city or county commissions that require they meet in person. It is a very conservative viewpoint that the Attorney General has developed over the years, and the courts are not necessarily bound to listen to the Attorney General on these issues. So it's never been litigated because everyone's gone along with the Attorney General. Certainly under the circumstances, it may be there may be a valid reason to continue doing it virtually. A view that we have had is that whatever you do, is that you do your best to provide public input and participation, because that is the purpose of the Sunshine meetings, is that people are able to attend. And one of the issues with virtual meetings are for people who are not technologically equipped to attend. Now, they can call in by phone, which is a good thing. And it's certainly one way to participate, but they can't necessarily see the exhibits and that sort of thing. So I'm not saying it's impossible, but it is clearly going against what the Attorney General has opined. But there are those who disagree with that.
Yeah, I mean, the majority of this board, it sounds like, wants to continue to meet virtually, and I'm happy to modify my motion to make a finding that virtually is considered present, if that's the will of this board. I just know that the county has taken a hybrid approach and wanted to make that available. So,
Anyone else? Bob, so what's the downside? Does it, if say we're challenged, then do all of our actions that we've taken while we were doing it virtually, are they in limbo, or are they negated until it's, until it goes through whatever legal proceedings it goes through?
It would be challenged. And the cure is relatively easy. You just hold an in-person meeting.
But,
that.
and, okay, but what happens to all the things that we've done? Say like,
If you aren't challenged on them, nothing. They proceed accordingly.
okay,
Um,
but if we are,
if
for
you
some
are,
reason.
then the cure is to conduct a meeting in the sunshine, which would be in person. And you
And
could,
that-
you
and
could do that short of litigation.
And the actions taken while the meetings were virtual, what happens to those?
You could, on a very long meeting, revisit everything and confirm them, giving the public the opportunity to comment on them.
Okay,
So it would have to be more than a pro forma ratification. It would be, okay, we did this. Does anyone have any objection? Any public comment? Do I hear a motion? There we go.
okay, all right. Okay, all right, Dr. Hart?
Just one more thing, Bob, to clarify. If we have opportunity for public comment during our normal order of business, and somebody says, you didn't hold the meeting in person, therefore I'm lodging a complaint, can't we use our records that members of the public had access not only to our materials on the meeting, which are available on our website? They had access to the agenda, which was available on the website. They had access to a phone number and a computer link so that they could come to the Zoom meeting. I mean, it's not like Colin hasn't done all the work already to as comfortable as possible for a community to participate. We've already done it, and we've already had a record of showing that people indeed do chime in if they want to be heard about what we're handling.
But it's a legal matter at that point, Dr. Hart, and no telling where it goes. You know, anybody can sue anybody for anything. And so what you say makes perfect sense. However, it would still have to be, it would be litigated. So it wouldn't just go away automatically. And I think, do you have anything else, Dr. Hart?
Well, I'm trying to envision a scenario like who's going to be upset at our doing this. I can only think that people might be upset in retrospect if they don't like a decision that we made. Of course, they could be upset in retrospect if we meet in person or not. But that's the only scenario in which I can envision that someone would be upset that we were meeting virtually instead of in person.
If there are no more hands, I think Colin would like to enter into the fray. Colin?
Member Twombly has her hand up.
Okay.
I was
didn't
just
see
gonna
it.
say, it sounded like though, even in the hybrid version of our meeting, we're talking about the public not doing that, calling in or doing it virtually. So
Cheryl, I apologize. I didn't get a lot of that. I'm sorry.
my internet may be bad. Can you hear me now?
Yeah, I can hear you.
Okay. So my question was, is even in the hybrid version, what we were talking about was that the public would not be there in person. It would just be us there in person. They would be still attending virtually. So it seems like the public's going to attend virtually no matter which way we go. So it wouldn't be different.
Well, theoretically, if I heard Ken correctly, there would be possible some public participation if we went to the Board of County Commissioners room. Is that right, Ken?
The way it's going to be set up, Lee, is the commissioners are going to be in the chambers with staff, and then the public will have access to a Zoom in Grace Night. And so just like they would have access to a Zoom at their house.
Okay, all right. So they won't be there physically to interact with the
Right.
commission.
Yeah,
Okay.
so Lee, I'm gonna withdraw my motion and make a new motion that we follow the city's guidelines, which make a finding that Zoom meeting qualify as being present, and that and that's part one. Part two is that Colin reaches out to Mark, so that when and if we are challenged or need to move to a hybrid approach, that we are ready for that.
Okay, we have a motion. Do you have a second?
Second is Tina.
Okay, second, motion by member Cornell, seconded by member Surton. And Colin, you want to get into this?
Yeah, I want to address the who could be mad question. This isn't really how I was expecting the discussion to go. And I think I would like some time to assess who I think could be mad. I think the governor's intent is that boards meet. I think a hybrid motion is risky enough. And I think going all in and saying we're not going to follow the intent of the governors may be fine. I would just like to think about it. And I think part of my job is to protect the trust, and I don't think right out of the gate defying an order from the governor. It could be okay, but I just found out about this on Friday, and I would like a chance to do my own homework and then come back with a better recommendation. No disrespect to Commissioner Cornell. It very well may be. I was already given the direction to reach out to the county and figure out how to make this work if we did a hybrid solution, and the information's changing every day. The hybrid solution the county came up with is that all 5 commissioners are going to be in a room, it sounds like, with the public coming through Zoom. That's different than the what was discussed at the last meeting. So I would just like a little bit of time to do some homework and give you a better recommendation. But I don't recommend that you go all in on the city of Gainesville's approach just yet until I've had a time to figure out who may be mad or who wouldn't be, or what the risks are, because right now I don't know.
That's fine, Colin, but we're doing that on November 4th.
Second.
Whenever you're doing the joint meeting, so. But I don't mind that approach either.
I think the risk at the joint meeting, because we probably won't be voting on anything, is probably very low. It's really to figure out what to do going forward. But I think the who would be upset question is a very good question that Dr. Hart asked. And without being able to give a good answer, I would just, even if you give me till 2 more weeks, and would be helpful.
Okay, so Kim, what you want to do?
Well, I don't mind withdrawing the motion, but I don't want our next meeting to be in person without having a discussion about it.
Well, I think, Colin, I've heard a couple things. Number one, we will not be meeting our first meeting, but if you want a couple weeks, then will we be meeting on the 14th? And I think if nothing else, just to have this discussion, it might warrant having a meeting.
Okay. We can, well, honestly, I think Dr. Labardo has her hands up. Maybe she can rescue me here real quick.
Try. I mean, my thought was,
Y'all,
even-
it'd be very helpful because I don't have all y'all on the screen at once. If y'all use the hands up thing, I can see all that. But if you're raising your hand, I only have 3 or 4 people up there. So, Maggie?
So my thought is, and I don't know whether this rescues you or not, Colin, it can be a really brief meeting, but I sort of agree that we need to hear what Colin finds. I think it makes a lot of sense for Colin to do the research. I'm not sure that we're high on anybody's radar at this point for that kind of an issue to surface, but it can. And I certainly don't think we need to have any controversy when we're just out of the gate. So I think it makes sense for Colin to do the research. I think even if it's the only agenda item and it's a 30-minute meeting, not the first meeting that we were scheduled for, but I think somebody said the 14th, then I think it makes sense to just go ahead, hear his report on what he finds, make it a single agenda meeting and move from there, rather than rush into making a decision on something that could come back to bite us, if not legally in the end, but certainly in terms of public relations and our relations with the governor's office right out of the gate.
So Lee, it seems like we could do that meeting virtually, and then if we need to confirm it, we can do it in person.
Okay, and Tina?
I had a question. So which meeting, what's this date we're going to do the virtual meeting on November 2nd? Or will we try to do a meeting next week, the 26th? Because our joint meeting with the city is November 4th.
Correct.
So I'm confused. So are we saying I thought we wanted to have a discussion before we went all, well, I guess my question, are we planning to meet with the city virtually? That's question number one.
And I asked that, and it looks like we are.
Okay, so that's what we don't think we have a problem with. And so then our next meeting is what this other discussion is being, we're venturing in to see what we should do.
Correct. And it looks like it'll be interesting to see whether it's going to be virtual or whether it's going to be in person. So, because that'll be after November 1st. So, Colin?
Yeah, I think that the date would be the 16th, and I think Commissioner Cornell's suggestion is fine. We can plan on that being virtually, and then if we have to ratify it at the December 7th meeting, I think that would be sufficient. And in the meantime, I just want to because a lot of this information is new. I just talked with Bob on this on Friday, and I think by the 16th, I can have a recommendation going forward for the rest of the year, how we should meet and protect our interests.
Okay. Thank you, Colin. So, Ken, you want to withdraw your motion?
Yeah, I'll withdraw my motion.
Okay. And then I'll get with Colin to figure out about the meeting time. Now, there's one other issue in the executive director's report, which was about the mental health component that was added to the motion. So, Colin, what are our options there?
Yeah, so when I listened back to the tape, what I heard from Dr. Labarta, and I'm glad she's here because is that a lot of kids are lost in the summer because they're receiving mental health services during the school year, and summer happens and they disappear and they don't get the services they need. And are there strategies that could be helpful with that? That's what I heard when I went back to listen. She may have some different ideas in mind, but my suggestion for that would be, I think we have, when you look through the reports that you have for the programs we're currently funding, a number of them have mental health components in there, some direct counseling, some that haven't started yet that will be. In my previous life, when we funded mental health programs, one of the questions we always asked in our RFP was, what are your strategies to keep kids with you during the summer? Are you going to talk to them by phone? Is it telehealth? What are the strategies? And those type of things were measured. So I'm not sure. We will undoubtedly have kids in our summer programs that are receiving mental health services during the school year if we end up funding a number of, let's say, summer learning sites. So I'm just wondering, I kind of see those as two separate issues. And so I think a more robust discussion on what our mental health system for children, whether it's they're receiving care at school-based sites or after school sites, I think that is worthy of a more robust and thorough discussion than to try to smuggle it in under the summer camp discussion and maybe not give it the attention that it deserves. So that was my only concern.
So what I was focused in on is, yes, those kids often disappear in the summer for a whole plethora of reasons, not least of which are transportation issues, access to the family that the schools often can facilitate. And I think it dovetails with Judge Bullard's concern, which is they then get arrested because they put idle hands, right? And the other thing I would say, Colin, is yes, I think there are some of these programs that have a mental health component, but I can tell you that for a while, Meridian used to do a summer camp for kids. And the camp had several objectives, not least of which was not just working on making sure that their individual or group therapy was continuing during the summer and that they were still seeing the psychiatrist if they were on medication, but really starting to build resiliency skills in a way that you couldn't do in a 1 hour a week session, but that you could do if you had kids over the summer or 2-3 days a week participating in some of those skills. And we were able to see these kids make great gains. And because a lot of the activities involved reading and writing some things as well, they also managed as a side benefit to keep some of the academic stuff from falling quite so far. Those were things that at some point Medicaid paid for, and then managed care made very difficult to fund through Medicaid. because they were rehabby, and Medicaid hates rehab. If that's a whole other conversation we could have, but so that was more the kind of access to summer programs, not just not losing the kids, but there are some really innovative and creative things you can do during the summer that not only keep the therapy up, but build a lot of resiliency skills and also help the kids keep some of their academic skills from going away. So that was where my head was with that.
Okay, so in other words, in the former Meridian camps, which I take it don't exist anymore, is that right? Oh, you're muted. I'm sorry.
Sorry, they're easier to do, oddly, in some of the rural communities. We have done them here. I don't know whether there are any plans for them this summer. I know every year they shrank, and they shrank because Medicaid made it harder and harder to qualify the kids. And that's where I think the trust can come in and do some funding for those kinds of activities that we know Medicaid restricts mightily or won't approve at all. And so a lot of the kids that really could benefit from a rehab model, Medicaid doesn't consider sick enough.
Mm-hmm. So I will, that's good feedback. So I think that my understanding is that the youth development framework and resiliency and the social emotional skills also come under the umbrella of youth development. So these aren't, in your case, some of the kids would have a diagnosis, but in general, for all kids. So I will circle back with our research group. And I think what it sounds like is we want to make sure that these types of activities will be available at least some of the programs that we end up funding. And so I think that can probably be incorporated into what we're doing pretty easily. So thank you for that. That's helpful.
Okay, so is that enough direction?
I think so. Yeah, I think so.
Okay.
I don't know if Judge Bullard wanted to chime in also.
Okay, Judge Bullard.
Sure. The reason why I raised that at the last meeting is since the whole purpose is to identify existing programs and gaps, is to identify existing programs for the older youth, and which, the 6 to 18. And I mentioned the DJJ, or Department of Juvenile Justice kids, not only the kids who are in the system who may be looking for summer programs, and but also kids in diversionary programs. So it really was to identify what's available in an effort to ensure that nobody is duplicating services, and again, to focus on the gaps and the needs for that older group.
Okay, thank you, Judge.
Mhm.
Anyone else? Okay, and you have the direction that you need, Colin, is that correct?
I think so.
Okay, so does that conclude your report?
Yes.
Okay, so you want to begin the discussion items?
Sure. You received probably all but 3 or 4 end of year reports from RFP 20-937. Just so you know, the framework for the reports were actually developed by Anna Delernia, the consultant we had do the portfolio review and then help us come up with our goals and priorities. And so one of the things we did is we had the proposed measures from each of the agencies, and then just created a second column that says, to the best of your ability, fill in what you actually were able to measure, and then give us a narrative on what you were able to accomplish, of course, taking into consideration all of the challenges with the pandemic and so on and so forth. So I just think it'll be obvious to you that some groups were able to do a lot because of the nature of their programming. Some were able to do a little bit. Some really haven't gotten started. Some programs spent a large chunk of their money because a part of it was capital expenditures, but they really haven't gotten to do any programming yet. So there was a wide variety of programming and a wide variety of progress year to date, but I'll just pause right there and just see if anyone has any specific questions or comments. The other thing I would point out is through September 30th, we also included the year-to-date expenditure report for all these programs. That'll change a little bit. We've been processing end of year invoices. So, that wasn't, no, sorry, I got distracted by the noise. So there was, those numbers, we'll have a little bit more expended, I would say, if we were to look at this report again in a month. But I'll just pause there and just see if there's any comments on any of those reports in general.
Any comments?
Real quick, Lee.
Okay.
So Colin, on the totals, as I read the bottom, budgeted 5.2 million, encumbered and transacted a total of 2.2 million.
Yes, no, as you're on the report, no, 2.2 million is what is left unspoken for. So that is not, those are program funds that have not been spent or encumbered.
So, right, okay, so I'm sorry, so the 1.1 million is what was spent and the 1.8 is what was not yet spent but is encumbered.
Correct.
And is the plan to carry that forward through 9/30 of 2021?
Yes, that, most of that. So that is already, you already appropriated all of the carry forward in the budget. A couple of those programs, for example, there's a transportation collaborative in there. I'm not gonna carry forward because they said with COVID, they're not gonna do transportation anyways. So there's a few programs that will not extend, so that money will just roll back into fund balance. But yes, that money has already been carried forward and you appropriated that as part of the budget.
And that 2.26 is what rolled back into fund balance for programming in December.
Yes.
Okay, thank you, Lee.
Okay, sure. Anyone else? Dr. Snyder?
Hi, Colin, thank you for pulling the information together. I was wondering if once the program manager or the director of programs starts with you over the next month or so, if it might not be helpful to categorize these programs according to the 4 results that we developed, so that we can begin to get a picture of how these programs, either individually or collectively, could or might help us be moving things forward with respect to addressing the results. I think it's a good example of something that could actually be some important strengths and needs assessment data for us as we look at these programs and others who might, be joining us over the coming years. So just a suggestion. Thanks.
It's a
Thank
great
you.
idea. In fact, in the budget, when you approved these, we gave it a shot and categorized these under the 4 areas. People may not agree which category we put them in, so we can always redo it, but we can start there and see how that looks to you.
Tina? You're on mute.
I am muted. Thank you.
Okay.
I was going to ask, this is just a little thing, Colin, when you give us the reports, if they would carry forward or print the headers, the column headings on each page. That was the first thing. It's on page 1, the annual budget amendments. Like we have the title on each page, but not the column headings. That would help me because I kept having to scroll back up and figure that out. And then,
Okay.
The other thing is I was wondering, I know all of them have that one little, what do we call that? The sheet, the page with their results with the little blue diagram to be completed, the little how much actual and all of that. And I think maybe if we give them also a little template of kind of like to lead them in on how to report their results to us a little bit so we can kind of get the same info from everyone. And I know this is free form, but that's just kind of going forward. That's just a suggestion so that we could make sure we're getting the results back in from everyone and asking for the same information and so that we can collect the same type of data from each of the providers so that we can make those types of comparisons. But it was just a half-year funding and then we had COVID. So I'm not going to be too hard on everyone, be a stickler. But those are a couple of things I think will help me in the future.
Thank you, Tina. Anyone else? Colin, going through the reports, there were many of them that seemed similar in nature. And and I was wondering if we get the, when you get the person who is going to evaluate the various programs, it seems like potentially if program A and program B are involved in mental health, if they could, see what they are doing. So perhaps there could be some collaboration going forward, so maybe we can get actually a little bit more bang for the buck as opposed to each doing it individually. And I know that was the first year, but hopefully going forward we can do some of that, with some of the after school programs, some of the mental health programs. It looked like there may have been some similarities in their functions. So any further discussion? Okay, there's no motion, so I guess I should open it up to the attendees. So I will do that. Anybody would like to address the board, they can do so. Okay. I'm not seeing any hands. So we'll go to the next item, which is CARES funding. Colin?
Yes, I just wanted to update you on our CARES funding. We took a two-pronged approach. So in the CARES funding, as you remember, we were trying to provide some funding for pandemic learning pods. There was an original vision that was presented to us that just wasn't feasible because of licensing requirements and other, just some other barriers that getting funding from a trust creates. And so we went to Plan B, which was to try to fill in some gaps. And when I say fill in some gaps, another thing that happened in the course of discussing pandemic learning pods is that the Office of Early Learning allowed their school readiness dollars to be used for children during the daytime to actually stay in a childcare center as opposed to school, which was a change they made specifically for the pandemic. And so our thinking is that there were probably some places that didn't receive school readiness that could benefit from these pandemic learning pods, or there were some children in the gaps that maybe didn't qualify for school readiness, but also still would benefit from going to these learning pods. So we ended up funding one center that met all the licensing requirements, but wasn't a school readiness site, and that was Kids Count of Alachua County. And then we asked the Early Learning Coalition to help us fill in the gaps and find the rest. And what we found really is that the change in funding from the Office of Early Learning really covered a much larger swath of the population than we expected. And so the demand for our CARES funding from that funding source really just hasn't been there. I think in the letter I received from the Early Learning Coalition, or the memo, I think they've only had 4 actually go through the process of signing up to date. But the demand through those 2 avenues just has not been there. So I just wanted to make the trust aware of that, because we were awarded some additional CARES funding from the county. Since Commissioner Cornell's here, it might be worth discussing if it's possible to reallocate some of that funding on our end. I know originally our funding was supposed to take care of the trust invested in the first 9 weeks of programming, and the CARES funding was supposed to pick up the rest. I don't know if maybe we want to consider reallocating, but I just wanted to make the trust aware and then just have a brief discussion on where we might go from here.
Hands, anybody want to participate?
I would move that the executive director reallocate eligible CARES Act funding to the best of his ability and put the request back in with the county. We are meeting, so that's my motion.
Okay, we have a motion by member Cornell, second. Is there a second? Second from member Certain.
And Lee, just so the trust knows, that meeting is November 2nd. And I would just recommend, I had a conversation with Colin, I would just recommend a conversation with Colin, to Tommy, so that when we have that reallocation meeting on November 2nd at the county, that the request is in.
Okay. Before we get into the discussion of the motion, Colin, there was something also about income with the families. What was that about?
That was a hypothesis. I don't know if that's, the hypothesis from the Early Learning Coalition was that maybe more children would have, I guess, opted into their program, or the parents would have completed the paperwork except they didn't want to report their income. As you recall, our criteria was at or below 200% of the federal poverty level. And that's the criteria we had for not only the Early Learning Coalition, but for Kids Count, which I believe, if I'm not mistaken, is a little bit higher than school readiness funding. I might need a fact check on that, but it's either right at what school readiness funding is or a little bit higher. And just trying to put our heads together and figure out why we didn't get more applicants. The Early Learning Coalition said some of the feedback they got is that those parents didn't want to disclose their income. I guess there's paperwork or things that you have to fill out. So I'm not sure we could prove that. That's anecdotal, but that was just one idea of why maybe we didn't get more applicants. Still, in any respect, 4 is a really low number.
Yes. Okay, there was a motion. Any discussion of the motion? Any discussion from the attendees? From the public? Okay, all those in favor of the motion say aye. Aye. Those opposed? Motion's unanimous. All right. The next item, Colin, you've got the, as an action item, cancellation of the November 2nd meeting. I think we've already done that. Do you need a motion for that?
Probably not. So we're going to meet on the 4th with the city commission, and then our next meeting would be on November 16th.
Okay, and do you need to say anything about the, for your information? About the local match white
Yes,
paper?
well, briefly. And so this will be, I think, just some conceptual things to keep in mind once we begin to meet and put together a funding plan. I have mentioned this before, but there's a lot of changes going on in child welfare right now. And it has to do with some federal legislation. And the conversation, the Secretary of DCF recently met with the board chair and the CEO of the Florida Children's Councils, our association, and presented this white paper. And the idea is that they have to come up with some state, we'll just call it some state regulations and definitions that are consistent with federal Family First legislation to draw down child welfare dollars. So child welfare, just for if you don't know, is funded part by the federal government and part by the states. And so the purpose of the white paper was to share with the children's councils their definition of what it means for a child to be in the system, and to get our feedback so that if possible, whatever programs we end up funding, either in the areas of child welfare or family prevention, that we get the opportunity, if we're investing public dollars towards those efforts, to draw down some federal dollars into Alachua County through the Children's Trust. And I have told you in the past that we're looking at doing that with some Medicaid match dollars already through some programming we have in the social emotional development program that we're funding in the early learning centers. What I wanted to point out is the there is a what we want to be careful of is that as the state goes through and starts cutting budgets in different systems, whether it's child welfare or K-12 or wherever these cuts may come from, is that we advocate that as much as possible not come from children's services, and that they should not feel that children's services councils are there to make up for things that the state cuts from the budget. If that's the case, we won't get very far. what we'll just end up doing is plugging a lot of state budget holes and not really getting to do new and different things in our community that we need to do. And so, so conceptually, as we go through and decide what to fund, you're going to hear probably a lot of systems experts talk about things the state has cut or underfunds or things they used to fund, but they don't. And it'll just be really careful for us, in my view anyways, and this is just me talking, that we still make sure that the state knows that what they're obligated to fund, that they fund, and that we're here to make systems improvements and to do things that we wouldn't ordinarily be able to do, not merely to plug budget holes. Because if we get into the budget hole plugging business, we will quickly run out of money to do any of the new and different and innovative things that we were created to do. So that is my comment on the white paper.
Okay. Any comments? Not that I can see. Okay. At this point, we're going to turn to the general public
Dr.
comments.
Labarda has her hand up. Oh, I guess she took it down. I'm sorry.
Beg your pardon?
I saw Dr. Labarda with her hand up, but I guess she took it down.
I actually did.
Oh, there it is. I'm sorry. I'm sorry.
So I hear that, Colin, and I totally agree. The state ought to fund what it's responsible for funding, but it doesn't. And I can tell you that what I'm hearing around mental health around the state is, well, they're looking at a 6% reduction in their funding next year in mental health in a system that's already, grossly underfunded. And Medicaid is also a challenge. And the majority of the kids that we see as most at risk are Medicaid eligible. So I think as a general policy, I completely agree. It's not our place to fund what the government ought to be responsible for funding. On the other hand, we need to be prepared for the fact that there are going to be significant reductions in key programmatic areas. And I don't know how you balance that. And I'm not saying you should ignore our policy, and I'm not disagreeing with you. I also know there's going to be a world of hurt out there when they come back, if they come back to look at this budget for things that are dependent on the state. Not only, I think, are you going to see the child welfare federal changes have a huge impact on some of the prevention activities that they've been able to provide prevention services because they've been able to use some Title IV money. But also you're going to see it then in the things that support that, like mental health services, substance use services. So I think we just ought to be prepared for the fact that there is going to be a significant service reduction in a lot of areas.
Okay. Anyone else? See if I can see any hands. Don't see any. Okay.
Yeah, yes, my hand's up,
Okay. All right.
I guess I just want to split the difference between what Colin just said and what Maggie just said. I have to agree that we aren't supposed to plug holes for the state because that's a losing battle. There's a hole in the bucket, dear Liza. But we have, as a group, already shown our commitment to trying to change systems by thinking about certain mental health problems differently, for example, and certain mother-baby problems differently, and certain prevention of child abuse and neglect differently. And I think if we were going to stay with our mission to try to change systems to make things better for kids, we could actually, instead of filling a hole for the state, embellish our programs that we've already got going and figure out ways to make them knit together better, collaborate better, feed off of each other's strengths, and figure out what the weaknesses are and work on them. And I see Pat Snyder nodding, because this is the way we strategize with our funding to meet some of these needs in the new ways that Colin referred to.
I'd like to make a comment on that, Lee.
Thank you. Go ahead.
I think it's really critical, and I really appreciate Nancy's comments, that we not take a scarcity approach, that we continue to take a different approach, because when you step forward when no one else is stepping forward, sometimes you create things and the pie gets bigger in ways that you may not have imagined through private funding and partners and families that have kids that need help. And so I think we should continue to not take a scarcity approach. The pie doesn't have to be a certain size. We can do something different. And I just wanted to make that comment.
Thanks, Ken. Okay, I'm looking. I think I saw a hand. Wait a minute. Dr. Snyder.
I'm just going to endorse what everyone has already said and agree that sometimes when we all are facing these kinds of adversities, we have the tendency to want to run away from each other and protect our own area. And so I think we really have a responsibility as a trust to help people understand that together we really will be better. We'll be able to be more efficient. We'll be able to deliver perhaps not just more services, but really identify what kinds of supports we have in this community that don't necessarily get categorized as services, but are really important supports for children and families in our community. And so I think, again, trying to get out of the service mindset alone and really think about services and supports as part of a comprehensive system that we design.
Thank you. You got a thumbs up, I do believe. Anyone else? Okay.
I'm going to say, because I'm the system that's going to cause all the havoc in our community, we are looking at a across the board 6% reduction, and it is every one of our programs are going to be child welfare, economic services. I think as a system, we're just going to have to think more creatively. Still get the work done. I think partnerships, but I do think we can get it done. I hope we can stay focused, even though we're not wanting to replace what the state budget is pulling away. Have a huge impact on it.
Thank you, Cheryl. Anyone else? Okay, I'm not seeing anyone. So at this point, going to general public comments. If you are listening or watching this meeting through the webinar format, please use the raise your hand function. Simply click on the participants icon in the Zoom toolbar and look for the raise your hand button on the bottom right-hand side of the screen. If you are using the meeting, if you're viewing the meeting through the webinar, you may also comment through the chat function. If you're watching via Facebook Live and would like to comment, please use the number that's on the screen and the ID number. So if anybody has anything for the board from the public, now is your time. And I am seeing two hands. Let me see if I can get them. Leah Gallioni.
Galleon, fine.
Okay.
Hi, this is Leah Galleon. I am.
Leah, your phone's not doing well. We're not hearing you. Lee, I'm gonna go to the next person and maybe you can get
I'm
in a
the
better.
director of the bridge this week. I also sent a letter to the board. Can you
Okay,
hear me?
I can hear you
The
now.
next caller.
And you're gone.
Hello?
Hello? Okay, Addison. Leah, I tell you what, let me come back to you. Your phone's not doing real well.
Great.
All right. Okay. Yeah, Addison, go ahead.
Yeah, good evening, members of the board. I just wanted to follow up maybe on Lee's comment last trust meeting. I was in and out due to just connectivity issues, and I wasn't sure if you guys had mentioned it during the meeting, but wanted to follow up to see if there was any decisions made on continuing funding for programs that were funded for the kind of first year funding cycle and that first RFP. to see if any decisions or staff recommendations was made on that, as some of us, including one of our projects, is very close to ending funding, and wanted to plan for the future or budget for the future. And if I miss that, I'll try to look back, but if not, I'd like to advocate for it to be considered for programs to either come back to the trust or come back to Colin with a proposal to continue funding, because some of the programs and services that were being provided as a result of that funding are going very well, and we would hate to see some of those services stop, especially in the midst of a pandemic. And I would hope that, I would think it'd be not that much more money to continue some of these projects just until the end of the school year. But those are my comments, and I can tune out, I guess.
Thank you, Addison. We appreciate it as always. There are a few things in the chat. One from, I think it's Tanya Tillman. I think it didn't complete the name there. So is there an application enrollment period? Colin, we will determine that at our meeting in December. Is that correct?
There's no application right now. And yeah, in December, we'll make some decisions on how that's going to look.
Okay. And there were a couple other comments thanking us for our deliberations. Another, people attending via Facebook platform do not get recorded in the meeting attendance. And then someone also seconded that the question about the application. Okay. Let me get back to, are there any other attendees who would like to make a comment? Leah, did you get the phone thing situated?
I think so. Can you hear me?
Yes.
Okay. Yes. Addison basically asked my question. I think Colin said he was going to come back this meeting with a proposal on how to kind of fund Addison's and my organization and some of us that are in the same position. And so I just was wanting to get an update on that. So thank you.
Okay, thank you. As it stands right now, he's coming back in December, and that will be how we do things going forward. But it does not include the current programs that are going. It will tell us how we're going to look at spending the money in the next go round. Any other questions? Okay, I don't see any. So the next item would be, beg pardon? In the chat. Thank you. It's a comment to Olivia Hollier. To piggyback off of Addison, many programs will have a bare minimum, a salary lapse for the new application. What are the plans, or has there been any discussion? Most programs were given 6 months worth of funding because of the abbreviated fiscal year. And we answered that the next meeting, Colin will be coming forward with a plan going forward. All right, so now to the board member comments. Member Certain?
Yes, I do have something. Thank you,
Okay,
Chair.
sure.
I'd like to thank all of the participants on the call and the folks who came. I just kind of want to put this out there because I have gotten several inquiries about the new funding cycle. And folks know that I push real hard for us to get money out to the community based on the fact that we inherited the trust. When I say we, meaning the Children's Trust, there was no trust before the voters approved it in 2018. But the trust inherited those 3 contracts that were that came out of the Children's Advisory Services Board, the CASB. So I pushed real hard for us to get that out there. So I just want, but we did say that funding was just, it was a one-time funding and we couldn't come back. I feel bad that we're not ready to do an application now so that there will be no lapse in funding, but we kind of got to put a stake in the ground and get it done right. And I was hopeful that we would be at a point now where we would have an application to go out and where there wouldn't be that lapse in funding, but that's just not the way it's just worked. I mean, like you all have had to adjust with your program. And so we hope that you would be understanding and bear with us as we try to right the ship, so to speak, and get to a place where we can put together a funding plan and do good work that'll be continuously. And hopefully the cycle won't be a one-year cycle where everybody will just be scrambling every year to apply. We'll have something that'll be a little bit more stable, kind of like the CAP program or United Way and the other grants that are doing things out there. So those are my comments, and I look forward to what Colin will bring back here shortly to us. Thank you.
Tina. Member Clark sent a message saying that her connection is not very good. She has no comments. Member Cole Smith.
Yes, just one comment. Whatever we're doing as it relates to children, I'm hopeful that we'll have programs and initiatives that are equally important for parents, because the children and the parent connection goes hand in hand. So as we support and fund the children-related programs, let's make sure that we give a lot of attention and priority to the parents programs as well, because the parents have to support whatever the children are involved in. And the parents also need the training and the resources and the connections in order to be better advocates for their children. So it's sort of difficult, at least from my view, to invest, most everything with the children without having the parent component as well.
Thank you, Karen. I agree wholeheartedly. Ken.
I agree. No comments.
Okay, Dr. Hart. You have your hand up. Oh, there you go.
I don't have a brilliant idea about this, but I'm beginning to lose sleep over the looming number of evictions in our community. And it kind of is a perfect segue from Dr. Cole Smith's comment. It's a parent problem, but it's a children problem. And I think we ought to try to figure out ways that we can intervene on behalf of especially single moms with small children who are about to be evicted. And are there things that we can do to create safety around those family units?
Thank you. Dr. Labarta. I'm sorry. Maggie.
Am I there? I'm
Yes.
not muted. Okay. I just wanted to support what Tina's statement. I know it's frustrating for those folks that got a small round of funding and are looking forward to more, but I think it's really important that we do this in a structured and priority setting way. And I think we're doing the hard work, but it is sometimes frustratingly slow. So just wanted to support those comments.
Thank you, Maggie. Pat.
Nothing additional. Thanks, Lee.
Okay. Cheryl? Cheryl, do you have any comments?
No, I'm good.
Okay. Suzanne?
No.
Okay. And I don't have anything either. So I'm, okay. Tina?
Can I ask you a question? I support what Dr. Cole Smith said. I just don't know how, like I was sitting here thinking, how can we support the parents? Because based on the state statute, are we allowed to do anything like that? Have an initiative that would support the parents? I do understand the connection, but I'm trying to figure out how can we do that? Because it seems that
I don't think there's a problem whatsoever, because it's supposed to be for the children. And if what you do for the parents is going to have, an inherent benefit to the children as well. So I don't see a problem, but they're probably better minds than mine. I think Colin wanted to jump in there.
Yeah, we're already supporting parents. So I think a nurse home visiting program is supporting parents. I think the family strengthening workers with the social emotional development program is supporting, they work directly with families. I could envision something in the area of juvenile justice, either prevention or intervention, where we have programs that work with children and families. Maybe they do family child psychotherapy or something like that, that works with families and children. Yes, there's evidence-based family strengthening programs funded by other trusts that work with families. I think even if you look at other similar programs like Head Start, where part of the program is to get parents to read with their children at night, that's, indirectly working directly with parents and families. So there's a lot of ways that we could, legally do that. Because I think a lot of people recognize that, parents need certain skills to help their children, and we can support that. And we already are, so.
Okay, all right, good. Thank you for that clarification. What I was thinking that Dr. Cole-Smith had in mind was something that was directly targeting parents. I understand the collaborations and how we would help build up the skill set of parents and strengthen families. But I was understanding her to say that, like, we needed to have programs that their focus was primarily on the parent. So I get what the angle you just explained on, but that's why I was confused. That was my question.
Ken, did you want to say something?
Just real quick, at the meeting at the beginning of October, for those of you that don't know, the county did expand the Individual CARES Act application amount to $7,500 one-time fee plus $2,000 ongoing. So for those families that are suffering hardships or facing evictions, in addition, the county allocated $6 million to nonprofits to help those folks as well. And the application deadline is November 15th. So to the extent anyone knows of specific families, please have them apply to the county's website, and they can also call the hotline for help with an application, because we'd like to help if we can.
Thank you, Ken.
Also, the average monthly income was increased from 120% AMI to 150%. So we actually expanded who qualified as well. So we're trying to touch as many folks as we can. So
Thank you. I don't see any other people, and I've been through the list. So to talk about the meeting dates, the one on the 2nd has been canceled. The special meeting on the 4th, I guess it will be virtual, and Colin will get us the information later. And there was one more chat, and I guess it was in reference to about the parents. It says absolutely takes a team. It's from Jasmine Copeland. Big Brothers Big Sisters is working with parents on a daily basis. So with that, thank you all very much, and guess we'll be seeing each other virtually on November the 4th. And until then, I hope everybody has a wonderful couple weeks. Thank you very much. This meeting is adjourned.
Be safe.
Okay, thank you. See y'all.